And good Friday afternoon, folks. This is our first meeting of the year. This is our first video. So, hey, first of all, Happy New Year to you. I hope you guys had a great New Year celebration. I know we've been out of the office for a minute. Now, this week, we're back at it. We're back at it. 2025 is in with a bang, and there's a number of things that we will need to talk about throughout the year. But this meeting, this conversation today is about setting the deck chairs, right? So there are things about our agency that you have to be aware of, right? Most people know or understand that we are in the health and life business. We're in the health and life insurance agency business, right? That's what we do. We get people set up for life insurance. We get people set up for Medicare. Most people aren't aware as to what's the genesis of everything that we're doing. The genesis of what we are doing, we refer to as retirement healthcare spending. We work with people 55 years old and older, working their way to retirement and through retirement. That's our job. Our job is to get you in a place where you can first get reimbursed. Okay. Why do I say that's first? That's first and primo because look, you're going into a stage of your life where I got to tell you, for most of you, you really haven't had any health concerns, right? Really, from 18 to maybe 34, you probably didn't even take any medications. Maybe from 34 to maybe 64, guess what? Some things have possibly changed, right? We're probably taking some medications, but we haven't been hospitalized, right? It's during retirement. That's when you're going to spend money for the hip replacement. That's where you're going to spend money on the knee replacement. That's where you will probably have a hospital stay because of an emergency. That's where you will have a inpatient hospital stay because things happen, right? There will be a number of things that will happen during retirement healthcare spending that you need to be aware of. And once you are aware of them, the first thing that we need to do is say, there's a reality check here, right? Because the first thing you have to say is, this stuff is going to start costing me some money. And it is. And the issue isn't that it costs money. The issue is that once you spend that money, it's gone. But what if we can get reimbursed for those expenses? And that's what we teach people. First, get yourself in a position where you can be reimbursed for the hospital costs and medical costs that you could possibly incur. Okay. Once you do that, then make a decision about your Medicare supplement or your Medicare Advantage in Part D, whatever it may be, right? Those items, believe it or not, are secondary. Most people think about this all wrong. Your first primary goal during retirement is to get reimbursed for medical and hospital costs. Why? Well, most of you don't have long-term care, right? Most of you have never planned or thought about it. And most of you, I got to tell you, you don't want to think about it. I've been doing this for 20 years. I know the signs. Okay. But here's what I'm going to tell you. If we start thinking about these things in a different way, the outcomes are in our favor. Okay. Keep that part in mind first. I'll talk more about that throughout the next few videos that we will do. It's our goal really to try to get 2 videos in per week. And then one of those videos was probably going to be a little lengthy. Okay. We're going to try to keep most of our videos around 2 to 3 minutes. Really light things that you need to know about your Medicare Advantage plan or what's in your Medicare supplement plan and things like that. That's really easy stuff, right? But sometimes some of the conversations will be a little bit weightier in matter, okay? You need to understand what happens in skilled nursing, right? You'll need to understand what happens if you need or require hospice, right? So those are longer conversations, and we will address those things, right? But for the most part, we'll try to keep it light as possible. But, folks, I do want to close with this. I am doing an agency launch. And that agency launch will be this coming Wednesday, January 22nd at 6 p.m. It's a virtual meeting. So all you have to do is click on the bit link or scan the QR code, get yourself registered for that meeting. Who's this meeting for? Really, folks, this meeting is for people 55 years old and older, right? There will be a lot of conversation regarding people who are aging in. Now, you may say, well, I'm already retired. I'm not aging into retirement, but you have kids, okay? And your kids may be impacted by some of the things that are happening. Think about what happened, well, just a week or two ago with regard to Social Security. That will be huge. Tell your kids today that they could expect to get 20% less in Social Security income and see how they respond. Okay? That's important information for them to know. We're going to talk about those particular things. It's important, right? But we're also going to talk about how do we secure ourselves during retirement. We're going to talk about what we've been doing. Folks, we've been exercising this reimbursement strategy over the past really 15 years now. Okay. It's beneficial. You need to have a reimbursement strategy if you have a Medicare supplement or a Medicare Advantage. Both. Now, I know my peers, right? My peers don't do this. I listen to a lot of the language that they use during their vlogs and some of their meetings. They get some of the gray area, some of it, right? But for the most part, they haven't quite, the light bulb hasn't quite clicked yet. Okay, so since it hasn't quite clicked yet, there are things that they're doing that aren't necessarily beneficial to their members. They're working against their members. It's our job to work for our members. So, in order to do that, we need to tell you what type of roadblocks you could run into and how to deal with them. Now, I grew up playing football, right? And I got to tell you, my brother was much better than me. I was probably better at coaching than I was at anything, right? But for the most part, I'm going to tell you, I use a lot of football metaphors. The game has changed, okay? No longer are we just electing a Medicare strategy and we're just blocking and tackling and running it in between the tackles, right? Much like how football has changed from running the ball to passing the ball to slot plays and off tackle plays and different defensive schemes and all the rest. Guess what, folks? So is your Medicare. So it's my job to coach you through this. I'm your coach. All you got to do is run the play. Run the play, you'll be rewarded. Okay? That's what we teach people. So we're doing a launch meeting on the 22nd. Hit the big link. Get registered for that meeting. It's not going to last long. It's going to be about an hour or so, right? Miss Terri is going to do a lot of the speaking at this meeting. I will be there to open it up and close it up, answer any questions that you may have as well for those who are retired, right? And for those who are retiring who may have issues. You may we'll get some of those frontline questions answered, but if you want some more extensive time to talk about these things, that's what we're going to tell you. Go to the website, right? Get yourself a meeting time. Give us about 30 minutes to talk about your concerns and let's start forecasting, right? Look, I go back to this reimbursement thing one last time and then I'm going to let you go. Think of it this way. Everybody retires and they're not really thinking about the healthcare issue, right? But they have family members, right, who have healthcare issues, who may have come before them. And you have to ask yourself some questions. Could that be my lot? And if the answer is yes, then we need to strategically plan for that. No one wants to be dealing with cancer, right? No one wants to be dealing with a heart attack. No one wants to be dealing with a stroke. I knock on wood. No one wants to deal with that. But you have to look at the family history and ask yourself some questions. Could this happen to me? And if the answer is yes, we need to have a strategy for that eventuality. Okay? Because that's going to cost money. Most people think, well, I got the Medicare product, that's going to cover everything. No, it doesn't. If you go home after having a stroke, Medicare doesn't cover custodial care services. Anything that is not medical related or hospital related, Medicare does not cover. All right. So you need to keep that in mind. But it's our job to get you to think about it. And the first thing that we want you to think about is one, what? Get yourself reimbursed. Put yourself in a position where you can get reimbursed for medical expenses and hospital expenses. After that, make your choice on your Medicare supplement or Medicare Advantage. Once you do those two things, you're going to be ready to survive retirement healthcare spending. All right. And you'll be all the better for it. You won't be looking at reverse mortgages. You won't be looking at a lot of nonsense that doesn't make sense today. You'll be insulated and you'll be protected and prepared. Okay, folks, that's all I got for today. I hope to see you on the 22nd at 6 o'clock. I'm going to be sending out, you have received text messages, some of you have. I'm also going to be on the phone this afternoon talking to people about this meeting, getting people there. We need people at this meeting because there are important things that we need to discuss. Okay, and we want you to tell your friends about us. I promise you, we're doing things that other agencies aren't doing. And eventually they will. Like I said, they're going to have the light bulb moment. But they haven't so far. And we've been doing this for 15 years. So, folks, see you on Wednesday at 6 p.m. It's a virtual meeting. Hit the bit link, right? Or scan the QR code and get yourself registered. Folks, have a great Friday afternoon. And guess what? We'll see you soon.